Hello, and welcome to our presentation on determining which unhealthy lifestyle choice, obesity or smoking, has the greatest negative impact on healthcare costs, presented by myself, Susan Davis, Natalie Woodland, and Jingzi Yang. The problem that we are discussing is lifestyle effect on healthcare cost. The rising cost of healthcare is the topic of many discussions in today's healthcare industry, government, and individual lives. Much of the rising cost, 75% to be more precise, can be directly tied to chronic conditions such as heart disease and diabetes and the complications that arise from these conditions. Poor lifestyle choices such as smoking, poor diet, and an increased sedentary lifestyle are all contributing factors to the development of many chronic conditions. Each year, the healthcare industry spends millions of dollars on education to curb poor lifestyle choices in an effort to control cost and promote well-being. Beyond the rising cost of healthcare, the goal of many outside healthcare is to promote a healthier society. The General Assembly of the United Nations 2030 Agenda addresses the issues of poverty, hunger, and overall good health and well-being. Support for the goal of lifestyle modifications to decrease smoking and obesity would directly impact the goal of good health and well-being. The healthcare company that we are assisting with this project is the third largest insurance company in the United States and serves approximately 13 million customers. The company has a special focus on veterans and senior population. The company's commitment to healthy lifestyle for its members is laid out in their Healthy People, Healthy Planet, Healthy Performance initiative. The goal of our project was to assist the healthcare insurance company with identifying which modifiable lifestyle choices had the greatest impact on healthcare spend and assist the company with the development of a plan to address these findings that would incentivize members to change their behavior. During our literature review, we found, as mentioned earlier, that healthcare costs continue to rise. Poor lifestyle choices are leading to an increase in chronic conditions and the cost associated with these conditions. According to the literature, obesity is the most costly condition that can be dictated by lifestyle choices. Obesity can be the predecessor to other costly chronic conditions such as heart disease and obesity. Our literature review included studies on lifestyle choices and their effects on healthcare costs conducted by the Congressional Budget Office, the Mayo Clinic, and the Center for Disease Control. Each of these studies had similar findings, with obesity as the leading modifiable lifestyle choice that could be made to control healthcare costs. Individuals that are obese spend on average 36% more on healthcare and a whopping 77% more on medications to treat conditions tied to obesity. The upside to these studies was that as little as a 10% weight reduction can reduce medical costs on average between $2,200 and $5,300 over the average person's lifetime. I am now going to turn the presentation over to Jingzi Yang, who will discuss our data collection and how it compared to our literature review findings.
Thank you, Susan. My name is Jingzi. I will cover the data collection for our project. The data we will be using for this project was collected from 1,338 individuals, and we got this data downloaded from the website called Kaggle. For this project, we are required to use two methods of way to analyze the data. The first one we choose is regression. In the regression model, we're trying to find a relationship between our dependent variable y and explanatory variable x1 and x2. Y is a healthcare cost, x1 is BMI, x2 is smoking status. First, we made another dummy column for smoking status. We use 1 to represent yes for smoking and 0 to represent no for smoking. Since smoking status is category variable, on the data it says yes or no. We have to make the smoking status dummy column because yes or no are not numerical value. Only numerical value can formulate an equation. Next, we select the regression in our data analysis. Input Y range is a column for all 1,338 individuals' healthcare cost. Input Y range are the column for BMI number and the column of smoking status, which is a dummy column we just created. After we click OK, the Excel file determines a summary output in order to assess whether BMI or smoking status are a good predictor with the standard deviation of the healthcare cost. So we compare the standard deviation of the healthcare cost with our standard error. We find out the standard deviation of the healthcare cost is 12,1110, which is bigger than the standard error, 7,087.9. We conclude that BMI or smoking status, they are a good predictor of healthcare cost. And you can see the equation we find on this slide. Y equals negative 3,459 plus 388x1 plus 23,593x2. So the second method we choose is optimization. In optimization, our goal is to minimize the healthcare cost. We use solver in Excel to solve what are the criteria to minimize the healthcare cost. The set objective is to minimize the equation Y equals the one I just mentioned in the previous slide. So we change the variable cell X1 BMI and X2 smoking status. We only have one constraint, which is BMI greater or equal to 15. According to the National Institute of Health, BMI under 18.5 is considered underweight. In our equation, we have a negative intercept. So we don't want BMI to be calculated below the normal data like 0 and healthcare costs to be negative. In order to avoid this situation, we test the minimum BMI in our sample. It is 15.96. Then we set the constraint the BMI should be greater or equal than 15. The solver gives us the answer that BMI is 15 and the smoking status should be 0, which is no. So in that way, the minimized healthcare cost is $2,361. In our sample, the minimum cost is $1,121.87. The main reason for the variance is that our equation is not perfect. Based on the summary outcome, the R-square is 0.6579. The value of R-square implies that only 65.79% of the variance is related to the healthcare cost. It is explained by the variable BMI and smoking status. So if we say the R-square is closer to 1, and it means the regression relationship is going to be stronger and more accurate. So besides Excel, we also use JUMP to conduct a deeper analysis of our data. We choose smoking status and BMI as our independent variable because people can voluntarily modify those two variables if they want to live healthy lifestyle. Our purpose of this paper is to educate people to modify their current unhealthy living behavior and convince them to lose weight or quit smoking. We did not choose age because age will be changed involuntarily. People are getting old eventually, and we all know that getting older will somehow raise the healthcare cost. By using JUMP, we can also conduct K-mean cluster, which is a method of qualification. It is a useful tool in data mining. So we have three clusters. The first cluster collect 274 samples, second one collect 527 samples, and third one collect 537 samples. That is all from our data download from Kaggle. So in this slide, you can see a table of the result for the K-mean clustering. We generated the table above based on the three clusters from the data set. Cluster 1 has 38.5 average age, 1.113 average children, 30.708 average BMI, and everyone in this cluster is smoker. They have the biggest average healthcare cost, which is $32,050.23. Cluster 2 is the youngest group. Average age for this cluster 2 is 27.2, and they have less than one child. Average BMI for this cluster is 29.271, and they are non-smoker. So cluster 2 average healthcare cost is $5,006.58, which is the smallest average dollar amount. The last cluster in this table is the elderly group. The average age in this group is 51.3, and they have average 1.195 children. The average BMI for this group is 32, and they are non-smoker as well. So the average healthcare cost for cluster 3 is $11,798. By comparing the dollar amount, we can see the cluster 3, which is the elderly group, is almost 1/3 of the average cost for cluster 1, which is a smoking group. Because cluster 1 is a smoking group, and from our literature review, we already conclude smoking have a bigger impact on the healthcare cost. This finding really tells us smoking make a huge difference on people's medical charge. Smoking could damage our organ and our system, which will eventually hit our medical bill. This pip plot above is proof for our K-mean clustering. This image shows point and cluster of the data. Circles are drawn around the cluster center. The size of the circle represents the population in each cluster. The pink circle is cluster 1, which is a smoking group. The green circle is cluster 2, which is a young people group. And the blue circle is cluster 3, which is an elderly group. Both green and the blue circle, they are non-smoker. And once again, the pink circle, that's a smoking group. Now I will pass on to Natalie, and she will talk about the implementation and the evaluation for this project.
Thank you, Jingzi. Our methodology and conclusions are in line with much of the previous research conducted on the risk factors of obesity and smoking, indicating that obesity far outweighs the negative health impacts and associated healthcare costs. As such, when we move forward with implementation, we will utilize our allotted marketing and member education budget to specifically target the populations with known obesity and also the subset of individuals that are identified in an at-risk category for obesity. Initially, our efforts will be focused on direct member outreach and a specific lifestyle intervention choice. Outreach will be conducted via direct mail and also through the use of an auto dialer. Lifestyle intervention choices will range from nutrition and dietary classes to a gym or park membership, and also the ability to utilize tracking and fitness devices. Each of these cohorts will also be evaluated through claims data and additionally via member surveys on their overall health and well-being. Data will be gathered and reviewed each quarter as well as on an annual basis for the length of time that the member remains with the health plan. Specific analyses will occur to determine the impact of interventions on those in the at-risk category compared to those with a known and documented history of obesity. Our member. Participation for any of the lifestyle intervention choices is voluntary. However, there are incentives that can be earned for consistently engaging and also meeting targeted goals such as BMI reduction or a daily step count or mileage increase. In addition to the many physical and mental positive impacts that will be seen, incentives will also be geared towards healthy lifestyle choices, such as farmers market vouchers, fitness equipment and gear, and over-the-counter products such as vitamins and more. Members will also have the ability to continue participating despite meeting or achieving their targeted goals. This should encourage a true lifestyle change and support maintaining those achieved goals. Essentially, we're wanting a positive impact on overall health and quality of life for our members. As we evaluate the project and look at our stated goals, we were successful in identifying our problem to solve. We were able to determine through our literature review, research, and analysis that our efforts should be focused on one particular lifestyle factor, obesity. In identifying the most prominent lifestyle factor that will impact healthcare costs, we were able to determine how to best utilize an allotted budget for targeted population outreach and education efforts. For our organization, we were able to support key findings on a potential reduction in healthcare expenditure while also improving overall member health and satisfaction. Through this project, real value was seen by senior leaders through the results and outcomes. Our team was comprised of 3 individuals, all currently working within the healthcare sector. 2 with a nursing clinical background and 1 with a financial and accounting background. Each of our team members was able to bring a unique perspective and skill set to the project. Our team was consistently engaged and able to hold each other accountable for meeting key deadlines and stated objectives. Interactions amongst our team were respectful, cordial, and collaborative. Each student came into the project with some perceived notions around the topics involved, and we were able to learn additional detail throughout the process. Each student also gained an increased knowledge of data analysis and particularly the various approach methodologies, including regression, optimization, and vector quantization. We thank you for listening, and we hope that you found this information helpful.